Hi everyone, how are you doing? So today what I'm going to do is I'm going to take a question in this video which is asked in the examinations, and the question is, why are benzodiazepines preferred over barbiturates as sedative and hypnotics? Many a time I've seen these questions being in the university examinations. So I'll be taking up how to answer this question whenever you are getting this in an examination, right? So this is Dr. Deepika Tikku from Simply Pharmacology, and let's dive into this question right now. All right. So the first thing, why are you going to give benzodiazepines and not barbiturates? What's the reason? The first reason, and before I actually get into the reason, I hope you already know that benzodiazepines and barbiturates, they are both classified when we study the chapter of sedative hypnotics. Okay? Sedative is a drug which decreases the anxiety or calms down the person, decreases or subdues the excitement. Or hypnotic is actually a drug which will put somebody to sleep. Okay? So इसमें हम दो groups use करते हैं, benzodiazepines, barbiturates, and we have other drugs like non-benzodiazepines. अब newer drugs भी आ गई हैं, melatonin receptor agonists as well as orexin receptor antagonist. But अभी हम इसी question पे करेंगे. So effect on the respiratory and the cardiovascular system. Now, you know that the mechanism of action of both the drugs, whether it is your benzodiazepine or whether it is your barbiturates, the mechanism is the same. They act on the GABA A receptor. So, for the details on how they act, you please refer to my video, which I am, putting a link on. So that explains the mechanism of benzodiazepines as well as barbiturates for that. So they both act on the GABA A receptor in the brain. So what is the difference is like your benzodiazepines, they only increase the frequency of opening of the chloride channel. So they will attach to the GABA A receptor and they will increase the number of times the chloride channel is opening. So more chloride ions they get in, and more chloride ions when they get in, so they are going to create a lot of negativity. Or a lot of negativity का मतलब है there is going to be hyperpolarization, and we all know by now that hyperpolarization का मतलब ये होता है कि वो जो न्यूरॉन है वो stimulate नहीं हो पाता, so वो inhibited रहता है. So it will cause depression of the neurons. Now, so अब barbiturates ऐसा क्या कमाल करते हैं कि हम उनको ही नहीं यूज करते. So barbiturates का एक एक्शन तो यही है जो benzodiazepines करता है. But barbiturates are not happy with one action. उनको एक्स्ट्रा काम करना है. एक्स्ट्रा काम क्या करना है? They also increase the duration of opening of the chloride channels. So एक तो नंबर ऑफ टाइम्स ओपन कर रहे हैं, एंड जितने टाइम के लिए वो चैनल खुला रहता है, दैट इज ऑल्सो इंक्रीज. एंड व्हाट हैपेंस व्हेन इंक्रीज द फ्रीक्वेंसी एज वेल एज द ड्यूरेशन ऑफ ओपनिंग ऑफ द क्लोराइड चैनल्स, more chloride ions are going to enter, so more negativity, and they are going to seriously depress your central nervous system. And you know that in your central nervous system you have your very very important respiratory center as well as your cardiovascular center. So benzodiazepines का एक ये चीज होती है कि benzodiazepines normal therapeutic doses में and in normal individuals they do not suppress these centers to that extent. But barbiturates, because of this added two double action की वजह से ये ज़्यादा ही डिप्रेस करता है CNS को, और उसके साथ साथ they will depress the central nervous cardiovascular system as well as the respiratory system. So patient breathe नहीं कर पाएगा, उसका हार्ट सफ़र करेगा, so patient can land into emergency, right? In case the person takes a lot of barbiturates. क्योंकि ऐसा देखो क्या होता है कि when you are treating somebody जिसको like हम sedative या hypnotic इस स्टेट में देते हैं, सो पेशेंट को एंग्जाइटी है, लॉट ऑफ एक्साइटमेंट है फॉर सम इश्यूज, एंड यू वांट टू सबड्यू दैट, और पेशेंट को नींद नहीं आ रही, इंसोम्निया, देन वी आर गोइंग टू प्रिस्क्राइब दीज ड्रग्स. अब उसके लिए पेशेंट को वी डोंट एडमिट इन द हॉस्पिटल, सो यू गिव दैट प्रिस्क्रिप्शन एंड सेंड द पेशेंट बैक. Now the patient is back in his home, you're not watching over him, you've prescribed barbiturates to the person. Now let's say the patient actually is like a depressed patient, or has some mental issues or psychiatric issues. सो व्हाट हैपेंस, एक थॉट आती है उसके माइंड में कि यार इट बहुत हो गया, आई एम सो डिप्रेस इन दिस एंड दैट, मुझे नींद नहीं आ रही, मैं थक गया हूँ, ऑल दोस काइंड्स ऑफ थॉट्स दे कम इन. सो व्हाट ही डज, एक टैबलेट जो उसको प्रिस्क्राइब की थी लेने के लिए, उसके बजाय वो 10 की 10 टैबलेट्स खा लेता है. ठीक है, एट दैट स्पर ऑफ द मोमेंट. एंड व्हाट विल हैपन, इट्स गोइंग टू बी रियली रियली लाइफ थ्रेटनिंग फॉर दैट पर्सन, बिकॉज वो इतना डिप्रेस हो गया, उसके सारे सिस्टम्स बॉडी में, सांस कैसे लेगा, उसका हार्ट कैसे चलेगा. तो पेशेंट को अपने एक छोटी सी चीज़ के लिए आपने दवाई दी और देखो पेशेंट इमरजेंसी में पहुंच गया. सो एंड वो लाइफ थ्रेटनिंग है, पेशेंट कैन इवन डाई. सो देयरफॉर बिकॉज ऑफ दिस रिस्क वी कैन नॉट अफोर्ड टू प्रिस्क्राइब सच ड्रग्स. जो लाइफ थ्रेटनिंग ड्रग्स हम कैसे प्रिस्क्राइब कर दे पेशेंट को कि घर जाओ बैठ जाओ, नो. सो देयरफॉर वी डू नॉट प्रेफर बिकॉज ऑफ दैट हाई रिस्क टू द पेशेंट. Benzodiazepines, I would like to mention one thing. In normal individuals, जिनको कोई already respiratory issue नहीं है, cardiovascular issue नहीं है, so it doesn't create that much of an issue. But already if somebody has a compromised heart or a compromised, respiratory function, उसमें भी हमें careful लेना पड़ता है इसकी dosage में. You cannot just give it to them because it will further depress that, जिसमें ऑलरेडी प्रॉब्लम है. सो देयरफॉर फॉर एनी रीजन हम कभी भी ऐसी मेडिकेशंस वी डू नॉट वांट टू प्रिस्क्राइब समबडी फॉर एवर. दे शुड बी गिवन ऑफ एंड ऑन एज एंड व्हेन रिक्वायर्ड. डू नॉट मेक इट अ हैबिट फॉर द पेशेंट टू टेक इट. ठीक है, सो हैबिट फॉर्मिंग ड्रग्स होती हैं. सो बिकॉज ऑफ दिस इफेक्ट ऑन द रेस्पिरेटरी एंड द कार्डियोवास्कुलर सिस्टम, we do not prefer to give barbiturates. We only prefer benzodiazepines. They're much safer in this regard. Hopefully, right? Now, let's come to the effect on the sleep. You're giving these drugs for insomnia. So, this cat is on these drugs. She's sleeping soundly and nicely. Now, when you give these drugs to treat insomnia, what do you expect? The patient medicine lega, and next day when the patient wakes up, he'll be refreshed, he'll be fresh, usko neend अच्छे से आई, अच्छे duration के लिए नींद आई. So that is what the expectation is. But what happens when you give benzodiazepines? Those expectations are at least met. But when you give barbiturates, those expectations are not met because it totally gives a person, a very disturbed sleep. I'll tell you the reason क्या होता है. So, what happens is like एक sleep cycle में क्या होता है, for about let's say 7 hours की sleep cycle है. रात को हम 11 PM सोते हैं and about 6 AM let's say we get up. ठीक है, so this is the duration of the sleep time. And you know that sleep cycle होती है, stages होते हैं. So from stage 0 to 1 to 2 to 3 to 4. So they are all sleep cycles starting from this 0 phase, which is just you just trying to get to the bed and trying to sleep, and then followed by a little drowsiness, then sleeping, then deep sleep and all. So ऐसा cycle चलता रहता है. ठीक है, so once the patient or the person goes to sleep, he goes from this to let's say here, फिर इधर आया, फिर ऐसे गया, फिर ऐसे गया, फिर ऐसे गया. Ultimately the patient is awake. So this is the kind of sleep patterns we go through. Now, you know that there are two kinds of, the sleep rhythms, or we can say it is the rapid eye movement and the non-rapid eye movement. जो non-rapid eye movement होती है, ये हमेशा ज़्यादा होती है in percentage, and rapid eye movement sleep is less. Because there is rapid eye movement, so it's not actually a very, you can call a very deep sleep नहीं है. Your brain की electrical activity चलती रहती है, it's not at rest. So very small percentage of time the person will spread in the rapid eye movement. Most of the time the person sleeps in this non-REM phase. So with barbiturates ये architecture maintained है. But what happens when with benzodiazepines, but with barbiturates ये architecture maintained नहीं रहता. So what the barbiturates do, they increase the REM phase and they will decrease this phase. So उल्टा हो गया ना, तो रैपिड आई मूवमेंट बढ़ गई तो वो डिस्टर्ब रही उसकी स्लीप, रेस्ट नहीं मिल रहा उसको. सो अगले दिन जब उठेगा बड़ा चिड़चिड़ा होगा, इट विल नॉट बी वेरी फ्रेश बिकॉज ही इज नॉट गॉट अ प्रॉपर स्लीप. सो दैट्स द कंप्लेन विद बार्बिटुरेट्स. सो दैट्स द रीजन वाई बेंजोडाइजेपिन्स आर प्रेफर्ड. रीजन नंबर 2 हो गया. रीजन नंबर 3, आई ऑलरेडी टोल्ड यू दैट व्हेन यू गिव बार्बिटुरेट्स, even in normal doses when you're giving them, their therapeutic index actually is low. You know, normal dose में भी वो उसका सीनस डिप्रेशन कर रहा है, बट अगर थोड़ी भी डोज ज़्यादा हो गई तो क्या होता है, देयर इज़ अ मैसिव डिप्रेशन ऑफ द other centers in your brain. And one of the reasons I'll tell you here is because of the, what kind of graph we see. So let's say this is like your dose of these drugs and your central nervous system effects. Small dose has a sedative effect. You go slightly higher, there is a hypnotic effect. Slightly higher, there is an anesthetic effect. Slightly higher, there can be other effects, and especially the dangerous ones, medullary paralysis शुरू हो जाता है. More high जाएंगे तो coma हो जाएगा, और जाएंगे तो death can ensue, right? So when you give the dose, so if you're giving the dose of, let's say, benzodiazepines, so you give dose देते हैं, और जैसे ही आप डोज बढ़ाओगे, जैसे यहाँ पे सेडेटिव इफेक्ट थोड़ी बढ़ाई, हिप्नोटिक इफेक्ट और थोड़ी बढ़ाई, एनेस्थेटिक इफेक्ट और थोड़ी बढ़ाई, इट डजंट गो बियॉन्ड दिस, या आगे तक नहीं जाता. तो इसका जो एक्चुअली जो ग्राफ है, इट विल बी मोर ऑफ अ कर्व्ड ग्राफ, एंड यहाँ पे इसका प्लाटो आता है बेंजोडाइजेपिन्स को. इट डजंट गो बियॉन्ड, दैट्स व्हाई सेफर. थेरेपेटिक इंडेक्स इसका काफ़ी अच्छा है, बिकॉज आप डोज बढ़ाते भी जाओगे, सो बहुत ज़्यादा प्रॉब्लम नहीं है. And you remember this till these two effects. This is when the patient can, be at home only and take the medicines. So ये डॉक्टर सुपरविजन में एक्चुअली डायरेक्टली नहीं आती, बट इसके आगे आप जो भी डोज देंगे दैट विल बी अंडर डॉक्टर सुपरविजन, डॉक्टर के अंडर. सो ऑब्वियसली डॉक्टर ऐसी डोज देगा ही नहीं कि पेशेंट को प्रॉब्लम आए, ठीक है. सो दे आर रिलेटिवली सेफर ड्रग्स. बट व्हाट हैपन्स व्हेन यू गिव बार्बिचुरेट्स, सो उसका आप थोड़ी सी डोज यहाँ बढ़ा रहे हो. लेट्स से अगर हम ये वाली बात करें, ये डोज में सेडेटिव इफेक्ट है, ये डोज में हिप्नोटिक इफेक्ट है, इतनी डोज बढ़ाई एनेस्थेटिक इफेक्ट, इतनी सी और बढ़ा दी तो क्या होता है इसका, मेडुलरी पैरालिसिस, और थोड़ी सी डोज बढ़ा दी, कोमा. सो ये थोड़ा इसका स्टीप कर्व जाता है. दिस इज ऑफ बार्बिचुरेट्स. सो देखो, थोड़ी सी डोज में, लेट्स से यहाँ पे आपने 1 शुरू की थी एंड विद इन 5, इसको लेट्स से ये 15 है, 15 तक भी ये सेफ है, पर ये 5 में ही, 5 मिलीग्राम्स की डोज में ही, जस्ट एज्यूमिंग द डोज, इसका इफेक्ट कितना डेंजरस चला गया. एंड एज यू गोन इंक्रीजिंग, इट विल कॉज सेंट्रल नर्वस सिस्टम डिप्रेशन. सो देयरफॉर risky drugs, low therapeutic index, we do not prescribe. Coming to the other property, visit enzyme induction. So enzyme induction, it's the pharmacokinetic property where these drugs, for example, if you're giving a barbiturate, you're giving a barbiturate, it is a very, very potent enzyme inducer, which means it increases the metabolism of other drugs that are given along with it. So if you remember, there's a very important drug interaction. So you give a phenobarbital, which is barbiturate, along with oral contraceptives. So if you give it along with oral contraceptives, it will increase the metabolism of oral contraceptives and it will lead to failure of oral contraceptives and the patient has a chance of becoming pregnant. So this it can do with lot of other drugs. So अगर patient diabetic है, patient hypertensive है, कोई cardiac problem है, तो अगर आप phenobarbital you're giving with those drugs, you have to monitor the dose of those drugs also. How tedious a job it is. कि दूसरी कोई भी दवाई है उसको हमने मॉनिटर करना पड़ेगा, राइट. बट बेंजोडाइजेपिन्स आर नॉट एंजाइम इंड्यूसर्स, सो उनके साथ ये इशू नहीं रहता. सो इसीलिए ड्रग इंटरैक्शंस के चांसेस आर मच मच लेस एंड दैट इज रियली वेरी कन्वीनियंट, सो अगेन अनदर रीजन व्हाई बेंजोडाइजेपिन्स आर प्रेफर्ड. Abuse liability is much higher with, let me take a different color, much higher with barbiturates. Depression ज़्यादा है ना CNS का, so all those drowsiness, everything is much more with barbiturates. So addiction की chances ज़्यादा है. So again, it is less with benzodiazepine. So another reason why we don't prefer barbiturates. Coming to in case of now overdose. Now overdose अगर हो जाती है तो क्या करें. Let's say overdose हो गई है benzodiazepines की. सबसे पहला reason I told you it's not life threatening. एंड स्पेशली ओवरडोज में प्रॉब्लम ज़्यादातर इसलिए आएगी, आइदर ऑलरेडी द पेशेंट हैज़ सम कॉम्प्रोमाइज्ड respiratory system or cardiovascular system कोई problem है, or it can happen that the patient is an alcoholic, is already a CNS depressant, right? So जब CNS depressant होता है तो already depression है, फिर आपने benzodiazepines ऊपर से दे दिया, so और depression होगा. So that can be another reason like patient can have symptoms of overdosing. So like there'll be drowsiness, sleepiness, respiratory depression, cardiovascular depression, those kinds of signs and symptoms appear. But thankfully, we have an antidote for the overdose, and that is called as flumazenil. So flumazenil is a competitive inhibitor of benzodiazepine. It will bind to the same receptor of benzodiazepines and it will not allow the benzodiazepines to act. So it will immediately, within minutes, reverse the toxicity. But sadly, if I am talking about barbiturates, I told you already, they have a lot of issues if they are overdosed. And emergency to आई. The problem is there is no antidote available. So fast हम इसको reverse ही नहीं कर पाएंगे. We have to go through all the tedious procedures like hemodialysis. मशीन मिलती है कि नहीं मिलती है. Then gastric lavage. Then urinary excretion. So all these problems or such lengthy problems, and patient को हमें immediately हमें करना है उसको treat, or all these treatments take time. So there is a very less time to reverse the conditions of barbiturates overdose. So then overdose already dangerous, and then we don't have an antidote to take care of the overdose. So that's another reason. So all these are actually the reasons which you should mention why benzodiazepines are preferred over barbiturates as a sedative hypnotic. Otherwise, barbiturates are used in other conditions also, but वहाँ की बात हम नहीं कर रहे हैं. We're only talking about as a sedative and hypnotic. Why we prefer benzodiazepines? Nowadays, we prefer even the non-benzodiazepines because they're more, they're shorter in action and less of adverse effects. So, just a quick recap. Why are we doing this, or why are we preferring it? So, the first reason is that benzodiazepines have less effect on less depressant effect on the respiratory and the cardiovascular system in their therapeutic doses. Number one. Number two reason, effect on sleep. Benzodiazepines do not disrupt the sleep architecture. Barbiturates disrupt the sleep architecture, so they have a disturbed sleep. Number three reason, therapeutic index. Therapeutic index of barbiturates is very less, while it is wider with, or we can say narrow, it is wider with benzodiazepine because of the graph I've showed you. Number four reason is enzyme induction property. Barbiturates are very, very potent enzyme inducers, so they will induce the metabolism, or they increase the metabolism of the other drugs जो हम साथ में दे रहे हैं, and it can lead to failure of therapy with those drugs. So we will have to adjust the dosages of the other drugs, or that is a tedious process. So, and benzodiazepines are not enzyme inducers, therefore we are saved from this problem. Alright, number five, abuse liability. So, barbiturates have a higher abuse liability as compared to benzodiazepines. And number six is what happens if there is an overdose with these drugs. If there's an overdose with these drugs, thankfully with benzodiazepines also it is not serious. Secondly, we have an antidote available which can reverse the overdose within minutes. But barbiturates एक तो serious भी है, ऊपर से we do not have any antidote available for that. So these are the reasons you should mention. All the reasons करके you have to mention in your exams to get a perfect score. So I hope you liked the video, and if you did, do hit the like button, do hit the subscribe button if you're not already subscribed, and I will be coming up with these videos every single week. Thank you so much. God bless.